The mouth is the beginning of the digestive system, the gateway to the body. It's also the entrance to our airway and the resonating chamber for our speech. So when we talk about the mouth, we are talking about more than just oral health. We are talking about the health of our entire nation. Welcome to Crash Course Anatomy and Physiology. I'm your host. The mouth is made up of the external structures like the lips and cheeks, as well as the internal structures like the teeth, gums, tongue, and palate, both hard and soft. They are also the salivary glands that produce saliva, which is mostly water, but also contains enzymes to begin the process of digesting food and protecting the mouth from harmful bacteria. The mouth is supplied with nerves that allow us to feel temperature, texture, and pressure, as well as blood vessels that supply oxygen and nutrients to all these structures. All these parts work together to help us with mastication or chewing, swallowing, speech, taste, and immune defense. When we eat, the mouth breaks down food, mixes it with saliva, and begins the digestive process. After food is swallowed, it moves down the esophagus and into the stomach where acids and enzymes further break it down before it passes through the intestines, where nutrients are absorbed. Obviously, this is a simplified view of what goes on inside our bodies. But the point here is that the mouth really is the beginning of the rest of our digestive system. Inside the mouth, there are hundreds of types of bacteria that make up our oral microbiome. These bacteria are mostly harmless and actually help us digest food and protect against harmful microbes. But when the delicate balance of our oral microbiome is disturbed, it can lead to plaque, which can cause bad breath, cavities, and gum disease. And some bacteria that live in the mouth can cause infections if they spread to other parts of the body. For example, research based in the USA has found links between the oral microbiome and heart disease, diabetes, and Alzheimer's disease. In TI's series, we'll explore common oral diseases and conditions like dental caries or cavities, periodontal or gum disease, and oral cancer, as well as other conditions like oral thrush, dry mouth, or xerostomia, TMJ disorders, and cleft palate. We will also learn how oral health is connected to overall health, including cardiovascular diseases, which are linked to gum disease, diabetes, which has oral manifestations, pregnancy, and oral health outcomes, as well as mental health and so, which are impacted by oral conditions. To prevent oral diseases and conditions, we need to learn about oral hygiene, including brushing and flossing, as well as using fluoride and other preventive treatments. The role of diet and nutrition, and how often to visit the dentist for checkups and cleanings. We'll also learn about sealants and other preventive treatments and public health campaigns, such as those led by the CDC and the ADA, to promote good oral hygiene and prevent oral diseases. But despite these efforts, access to dental care in the U.S. is spotty at best. And because dental care is not always covered by insurance, many people skip necessary visits, especially those who are low-income or elderly or who belong to minority or immigrant communities. This lack of access results in worse oral health nationwide and contributes to health disparities. As we move through this series, we'll look at ways that policies and public health campaigns can improve access to oral health care and ultimately improve the oral health of the entire country. Next time, we'll start at the beginning and explore the anatomy and physiology of the mouth in more detail. Thanks for watching this episode of Crash Course Anatomy and Physiology, which was filmed at a studio and made in partnership with a digital studio in nature. You want to help keep Crash Course free for everyone forever? You can join our community on a crowdfunding platform.